everyone, and thank you for joining us today. So today we're going to be exploring culturally and linguistically appropriate services, which I will refer to as CLAS, or the National CLAS Standards. We'll discuss why it's important, and then we're going to talk about some practical ways to assess, plan, and implement CLAS at your organizations. So let's see. A little bit about NCFH. So we are a national nonprofit. We're located in Buda, Texas, which is just south of Austin, Texas. And our mission is to improve the health status of agricultural worker families through providing technical assistance and training, different kinds of products and services, learning opportunities through learning collaboratives to health centers. We customize training as needed for health centers on different topics. Some of the programs and products are listed on the screen. Our learning objectives for today are to define CLAS, or it's a broad, it's very large and in-depth, so we want to kind of help you simplify it, help you to be able to define it, why it's important in healthcare settings. We want you to be able to understand the different themes that are part of the CLAS standards, and we want to address how to assess, how to plan, and how to implement CLAS strategies in your health centers. So let's begin with, what is CLAS? So to get an idea of where you are with your understanding of culturally and linguistically appropriate services and what it means to you, using your chat box, tell us what you think CLAS is. And we'll review a few of the replies, and then we'll move on to the definition. So we'll take just a few moments to answer that question. And just to remind you, so there are a few questions, discussion questions that are embedded into the presentation. And so we really want to make this an opportunity to learn from each other. So we're going to be using the chat feature to be able to share and find out what each of us are doing, just to get a better understanding of CLAS in our organization. So it's important that we share and learn from each other. Okay, so I'm going to read a couple of the responses here. So there are guidelines to improve services. There are standards for providing appropriate care of diverse patients and populations. Being able to provide services in a consumer's preferred language. Yes, all of those are correct. So it's very important that we take this in consideration. Now, our first poll question is along the same lines, but it's more about how familiar are you with the CLAS standards? So are you very familiar? Are you somewhat familiar? Or not familiar at all? Or not sure? This will help give us a feel for where you are in your organization and how you understand the CLAS standards. So we'll take, I think, just about 30 seconds to answer the poll, and then we'll review some of the responses. All right, so I'm trying to make my screen so I can be able to read this. Okay. I think the results are all in. So the majority of you are saying that you're somewhat familiar. That's about 59%. And then we've got about 27% that are not familiar with it at all. And then a few of you, about 14%, are very familiar. So great. So we have a lot of you will be able to chime in and answer some of the questions and be able to share some of the information that you have with others. So that's exciting to know. Okay, so CLAS could be defined as the services that are respectful and responsive to each patient's culture and communication needs. Studies show that vulnerable populations are at greater risk for medical errors, longer hospital stays, and readmissions, which all impact quality, cost of care, and services. And implementing CLAS helps you prepare to better serve, like many of you answered, better serve these populations and to be able to overcome health disparities and to achieve health equity, which is, we all want that. Additionally, any organization that is receiving government funding, well, you're asked to implement and submit a plan of the work that you do around CLAS. So it helps with funding. So implementing CLAS makes sense all around. Should be a goal for all of us. So a little history about the CLAS standards. Well, it was first published in the year 2000 by the Office of Minority Health. It was intended to provide a framework for organizations to better serve the nation's diverse communities, and we know they're constantly changing. The enhanced CLAS standards, which were launched in 2013, were designed to be a little more clear, but they're also, the purpose is to advance health equity, improve the quality of care, and to help eliminate those healthcare disparities. And also to integrate throughout the whole organization and go into partnerships with your community, you know, to better serve your populations. Now there is a blueprint available to you, and you have the link for it in the PowerPoint. Basically, it's a guide. It's a guide that provides 15 action steps, which are the 15 standards. And it goes into a lot of detail. So if you haven't already seen this, the CLAS Blueprint that was, you can get it through Think Cultural Health Gov site. I encourage you to do so. It's pretty big. What we're trying to do today is simplify all of that information so that you can take it and be able to use it practically. Let's see. So we've got another poll question. This question is about how many of you have a formal organizational level CLAS plan or it's part of your organization's strategic plan. So the options are yes, my organization does have a formal plan. No, my organization does not have a formal plan, or you're not sure if a formal plan exists. So let's just take about 30 seconds to answer this, and we'll review, see where y'all are at, and we'll move right along. Okay, results. A majority of you are not sure that a formal plan exists. And then coming in equally at 26%, some of you said you do have a plan and others do not have a plan. Great. Well, we're going to talk about how to do an assessment, how to put together a plan, and we're going to share some tools that can help you do all that. Those tools are available for you to download. There is one of the tools is kind of like I don't remember on the top of my head the title of it, but it's a nutshell. It has all 15 standards. You can, if you have that available, that's great. You don't have to have it with you right now, but it'll help you as we talk about these throughout the presentation. Okay, so assessing needs, very important. One of the errors that we've seen organizations make is not really fully assessing your efforts around CLAS. You know, assessing the needs is important in helping to bring awareness of what you're already doing and the areas that need work, right? And as part of, we have a CLAS learning collaborative, we created several tools that I'm going to share with you today to help you with exactly these things, to help you find out where you're at, because most likely you are addressing CLAS in some way. But it's going to be helpful if you had a formalized plan and if you know exactly here are the things that we're doing that are working. Here are some things that we need to improve on, and it helps with funding to have a plan. So we want you to use these to ensure that you have kind of a guide to go along as you implement strategies that we'll talk about. So knowing where you're at is the first step. And then from there, you can create an improvement plan. And we have a template for you to work on that, which we'll share with you in a little bit, along with some, kind of like a little cheat sheet of strategies. But why is it important? You know, as we consider implementing the CLAS standards, we have a lot of things to think about. There's lots of external things such as health disparities, policies, other standards. You know, you've got the PCMH standards. You have healthcare or health center requirements. Well, implementing CLAS helps you to meet all of these. It impacts practice and it helps you to better care for your patients. Benefits of utilizing the CLAS strategies into your work are, well, it facilitates access and quality of care for culturally diverse patients, and we know that they're changing every day, year to year. We hear this from you. It helps to increase community participation and involvement in health issues. It promotes inclusion of all community members. It increases mutual respect, trust, and understanding. It helps to promote patient and family responsibilities for health. You want them to be proactive in their health care. And so it increases preventative care seeking behavior by your patients. Now there's complementary concepts that are cultural competency, linguistic competency, and health literacy. These are all about the linguistic competency. You want to make sure that your medical interpreters are competent. You want to make sure that your material is in clear, easy to understand language. And cultural competency is around health beliefs and practices and taking all of these into consideration, the language of your patients. This is a big picture of the standards. As I mentioned, it's a lot of information. There's one main standard, the principal standard, and then there's 14 other standards, but they're divided into 3 different themes. And theme 1 has to do with governance, leadership, and workforce. Theme 2 is all about communication and language assistance. And theme 3 is about that engagement, that continuous improvement and accountability that we are all responsible for. And during the enhancement process, the names of the themes were updated to help clarify their intention and to broaden the scope of their interpretation and application. Now, let's begin with Standard 1. This is the principal standard, and it emphasizes that implementing CLAS is the responsibility of the whole system, and it requires the investment, the support, and the training of all individuals within an organization. Standards 2 to 15 are all the practices, all the policies, and that are fundamental, and they're the building blocks of CLAS, and those are necessary to be able to achieve the main goal of Standard 1, which is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs, practices, preferred languages, health literacy, and other communication needs. So we need to be thinking about our communication style, our customer service efforts. We need to be in tune with our own cultural beliefs and ideas so that we don't transfer those to our patients. And most of you have these in your mission statements, or have something similar to this. So it's not new, and it's important to include as part of your strategic initiative. Now, theme 1, this theme provides greater clarity on the systemic responsibility. It requires the endorsement and investment of leadership and the support and training of all individuals. So it begins at the top and trickles down. Here is kind of again, a big picture or overview of the standards that are part of theme 1. This is part of one of the handouts that you have. The purpose of it, or the intent of this, was to kind of simplify the standards and to give you key words, key concepts, so that you could understand them a little bit better. It's more of a at-a-glance view of the standards, broken down by themes, and then it has just a few little strategies to take in consideration. Now, Standard 2 is advance and sustain organizational governance and leadership that promotes class and health equity through policy, practices, and allocated resources. We need those to do our work, right? So again, it's a top-bottom. You want to have a strong infrastructure, you want to have a strategic plan, and you want to have resources to be able to provide those things that you need to be able to achieve the first standard, the principal standard. So let's talk about some strategies that would help you to achieve Standard 2. Well, if you have, check, do you have written policies, procedures, practices that are around cultural competency? Does your leadership reflect the demographic characteristics of the populations that you serve? Do you have all those little pieces, like, and we'll talk a little bit more about the policies, and you'll notice as we talk about these that some of these overlap. But in general, this one's at the top level. And it's important to be able to establish those policies and the practices to be able to achieve the other standards. Standard 3 is about recruiting, promoting, and supporting a culturally and linguistically diverse governance, leadership, and workforce that are responsive, like I'd mentioned earlier, to the population that you serve. So you want to create that environment in which culturally diverse individuals feel welcome and they feel valued. This helps to promote trust and engagement with the communities that you serve, and it infuses that multicultural perspective into planning, designing, and implementing CLAS. It also ensures diverse viewpoints that so that they're represented in governance decisions. And it helps to increase knowledge and experience related to culture and language among staff. So what are some strategies to consider implementing along this particular standard? Well, you want to again, create that work environment. You want to be able to, you want to develop and maintain and promote continuing education and career development opportunities. You want to make sure that, develop relationships with schools, local schools, training programs, businesses, faith-based organizations to expand that recruitment base. And most importantly, you want to foster an environment in which differences are respected and that they're responsive to the challenges a culturally and linguistically diverse staff and population brings. So standard 4, which is the last standard of theme 1, is about training. So its purpose is to prepare and support a workforce that demonstrates the attitudes, the knowledge, the skills that are required to work effectively with our changing populations. We want to be able to increase the capacity of staff to provide services that are culturally and linguistically appropriate, and to assess the progress of staff in developing cultural, linguistic, and health literacy competency. We want to foster an individual's right to respect and non-discrimination by developing and implementing education and training programs that address the impact of culture on health and healthcare. Some strategies around that are to take advantage of internal and external resources available to educate the board. You want to begin with the board. You want to have their support. You want to make sure your leaders are on board. You want staff to understand cultural beliefs that they might encounter on an everyday basis. You want to incorporate cultural competency in class into staff evaluations. And you want to encourage staff to volunteer in the community and to learn about the community members and to learn about other cultures. So a starting point for training along this particular standard would be to take a look at your laws governing class. Take a look at your cultural competency 101 or health literacy 101. You want to look at cross-cultural communication skills and have an awareness of diverse health beliefs and behaviors, and be aware of the effect of biases on client care. And you want to resolve conflicts and respect the differences of your communities. So here's a question for discussion. What is one strategy that you're already implementing? We'd like to hear from you of something that you're already doing in your health center, or if you don't have something that you're already doing along that addresses these standards that we've just covered around leadership and governance, what is one of the standards that we just spoke about that you would like to implement? So let's just take about a minute. Use the chat box to answer that question. If you're doing something and you're proud of, please share it so that we can discuss it and share it with others and learn from each other. Let's see. Okay, so as I see some responses come in, I'm going to read them out, and then we'll discuss these. So That looks like staff does reflect populations being served. Great. Better messaging from the leadership in how all patient populations are being accommodated. So these are things that you're currently doing. If you could just specify doing these, or if it's something that you want to do, be sure to type that, include that in your chat box answer. And I'd like to invite, one or two of you to also if you click on the little hand, raise your hand icon, so that we can unmute you and you can share with the group what you're currently doing that's working. And Sylvia, if you can keep an eye out for that little hand. I don't see that icon on my view. So another answer, a response that I see here is, we'd like to ensure that what we are doing is documented in a manner to prove compliance. Yes. And you'll see with the tools that we share with you a little bit later how hopefully this will help you do that better or easier.
And Patricia, at this time, I don't see any raised hands. If you are not able to access the hand feature, just type a message in the chat if you would like to share something verbally, and I can unmute you.
Or so one of the responses is better messaging from the leadership and how all patient populations are being accommodated. By Catherine, is that something that you'd like to see? And you can use your chat to answer that if you prefer. And we'll just take a few more, just a little bit longer to see if anybody responds here. Great, yes, would like to see. Okay, great, yes. So definitely starting with your leadership team is really important, and getting them to really understand what CLAS is about, and participating. If you decide you'd like to learn more about the CLAS Learning Collaborative, I can help you with ideas on how to go about that. And then having, reviewing the tools and the strategies that are in your handouts too. But yeah, that's really important to see that from leadership. And that's all in this first theme, in theme 1, what it's about. You want to make sure that they're knowledgeable around CLAS and that they're championing it, in a way. All right, so let's move right along here. Theme 2. Well, theme 2 is pretty important. It has to do with communication and language assistance. This theme broadens the understanding and the application of appropriate services to include all communication needs and services. And this includes sign language, braille, oral interpretation, and written translation. And additionally, it helps organizations to comply with requirements such as Title VI of the Civil Rights Act of 1964 and the Americans with Disabilities Act and other federal, state, and local requirements that you might need to adhere to. So it's an important piece. So it basically it ensures that individuals with limited English proficiency or other communication issues have equitable access to health services. It helps that, so that individuals understand their care and understand the service options that they have, and that so that they can participate in decisions regarding their health and healthcare. So it's incredibly important. You want to help individuals be able to take care of themselves, be able to follow their healthcare plan, right? You want to improve patient safety and reduce medical errors that are related to miscommunication, which can be huge. So let's look at the first. Well, this is the overview of theme 2. There's 4 standards that are part of this theme. It's standards 5, 6, 7, and 8. And again, this tool is part of your downloads. It lists the standard. It has some like a key concept or keywords, and then a few little strategies to take in consideration. But let's go and let's look at each standard on its own. Standard 5 is about offer language assistance to individuals who have limited English proficiency and or other communication needs at no cost to them to facilitate timely access to all healthcare and services. So the key word here is offering. You want to have available interpreters, have those tools to be able to do that. So I would like to ask, currently, what are you doing in your health center that addresses this standard? How is your organization handling interpreter services for non-English speaking clients or hard of hearing clients? So use your chat feature and share with us, please, just a few little, some quick things that you're doing currently to address this standard. So EMR reflecting translation needs. Do you have bilingual staff, or are you facing challenges providing language access? Maybe you're looking for possible alternatives. We hear sometimes that the interpreters are no-shows. So how do you handle that? It's a big issue in health centers. So we'd like to learn a little bit about what you're doing in your health centers. So we have tele-interpreter for all departments, great. Bilingual staff, language line services, sign language service, video interpreting device, in addition to bilingual staff. Employing vendor to provide language interpretation by phone, bilingual staff for Spanish and Arabic, bilingual medical and dental assistants, telephonic translation and contracted interpreters. Great, those are.
And Patricia, I also received one saying medical interpreters, all trained as case managers, language line.
Great, okay. And lately I've heard buzz about like a phone app out there, and we're gonna dig a little deeper and get more information. It'd be interesting to see if anyone's already using that out there. Please share, let us know if you are. I'm going to go ahead and move on to the strategies for Standard 5, and those are making, and this is huge, making sure that staff is aware and that they're trained in how to use these language assistance services, right? You know, have them be aware that there are policies in place for them to do this, and then the procedures, the guides of how to use these services. You want to be able to develop processes for identifying languages that an individual might speak, such as using flashcards or I speak cards, maybe adding the language into a spot in the person's health record, and then using qualified and trained interpreters. And I just saw a comment come in about that. Testing interpreters for knowledge on medical terminology, language specific, even if bilingual. Yes, that's critical. And we have a tool to share with you that does that. This came out of another learning collaborative that NCFH did. And it's a quick one-page tool that helps you to assess the employee that is providing interpretation services. So you'll be able to download that and use it. And if you have any questions on that tool, you're always welcome to email us or call us, and we can help you with that. Okay, so these are all just some ideas. Some other ideas that we've heard are using cultural brokers when an individual's cultural beliefs impact care communication. So as our populations get really diverse and their cultures that we're not really familiar with, those become critical. Providing resources on site to help facilitate communication for individuals that experience impairment due to a changing medical condition or status. So great things that y'all are already doing. Standard 6, keyword here is informing. Inform all individuals of the availability of language assistance services clearly and in their preferred language, verbally and in writing. So it's not enough to just have the services available. You need to let the patients know about them, right? So informing them, making it easier for them to access, notifying how do you notify your patients about interpretation services? Are you doing this in writing, or are you just telling them verbally if you see that they're having a little bit of trouble communicating? Do you have procedures in place for staff members who serve as the initial point of contact for individuals, whether that's by telephone or in person? Do you have this information on your website? And another thing to consider is, do you, at every point of impact, like waiting rooms, exam rooms, triage, discharge, is there a sign that lets them know that language assistance is available? And also, it might be appropriate to provide staff with a script to ensure that they inform individuals of the availability of language assistance, to inquire whether they will need to utilize that service or not. So some people have the multilingual phone trees, or voicemail should also include these messages to let them know that help is available in their language and how to access it. So some strategies for this standard on informing your patients include, the signage. Let's see, creating notifications that describe what communication language assistance is available, how to get to it, letting them know it's free. Organizations should reflect the languages regularly encountered in the service area, in everything in their signs, material, multimedia resources, and you also want to include it in low literacy. And then briefly, we talked about a cultural broker, so a cultural mediator program would also be helpful. So standard 7, and someone mentioned this earlier in the chat, This one's about ensuring the competence of those individuals providing language assistance and recognizing that the use of untrained individuals and or minors as interpreters should be avoided, right? And we talked about the tool that's available to you to be able to assess the competency of those individuals, your staff that is providing interpretation. You want to make sure that you do that with everybody that provides services or translation services, to make sure that they are able to provide in the right terminology and things like that. We want to provide accurate and effective communication, right? We want to make sure that our patients are understanding, so that we reduce misunderstanding, dissatisfaction, and omission of vital information, such as misdiagnosis or inappropriate treatment. We need to keep all of that in mind. And importantly, we want to empower individuals to negotiate and to advocate on their own behalf for important services, via effective and accurate communication with the health care staff. So this is just kind of a screenshot of what the language competency tool looks like. It's very short, it's one page. So things that you want to consider. Do we have trained medical interpreters? Do we provide training for your bilingual staff? Staff may be bilingual in the language, but do they know the right terminology? And if you're going to use that staff, are you providing training for them? If so, what does that look like? The assessments, we talked about that. We need translators, but at what cost? So checking the competence level of your translators is critical. So strategies here, you want to employ a multifaceted model of language assistance. So organizations may provide language assistance according to a variety of models, which we named a few earlier in the chat. You want to include bilingual staff, dedicated language assistance via the video or remote interpreting. All of those are good examples. If you have staff that are medical interpreters or go through the training courses, maybe consider giving them bonuses for going through that training. So standard 8, right, policy and procedure say you mustn't use minors. Exactly correct, yes, good catch. Okay, so standard 8, and we'll talk a little bit more about these, is about the understanding, making sure that the material that you provide is clear and can be understood by the population that you serve. So low literacy, I want to make sure, I think standard is about 6th grade level, reading level, right? You want to make sure that you provide access to health-related information so that they can understand it and they can follow their instructions and keep to their plan. You want to be able to provide an effective way to communicate with large numbers of people and supplement information provided orally by staff members. So again, this standard helps you to comply, helps your organization to comply with the requirements of the Civil Rights Act, the Americans with Disability Act. I guess most importantly, in a simple definition of health literacy comes from the Institute of Medicine, and basically it means it's the ability to read, understand, and act on health information. Healthy People 2010 defined it as the degree into which individuals have the capacity to obtain, process, and understand basic information and services needed so that they are able to make appropriate decisions regarding their own health. What materials should we be looking at to translate? Some examples are like signs, directions, notices about availability of interpreter services, legal documents, consent forms, client rights and responsibilities, privacy notices. If you look at these forms, a lot of times they're like written in a very high literacy level. So we want to take in consideration our populations, and we want to make sure that they are more easily understood by everybody. So some strategies for this one are to go back, look at these documents that I mentioned, look at your client complaint forms, your privacy notices, grievance policies, intake forms. Some of those can be really overwhelming. And then that client education materials that are relevant to your particular populations, right? You want to make sure those are in the right literacy level. So looking at forms, making them easier for them to fill out. And we understand there's a lot of information we need to capture. So be thinking of ways to make it, to simplify it and make it more clear. And you want to be able to train your staff to be able to develop and identify easy to understand materials. So for this particular theme, what is one strategy that you're already doing or that you would like to do that addresses any of these standards in theme 2 around communication and language access? So let's use the chat feature once again and see what you guys are doing out there. And just take about a minute. Answer in the chat box, and then we'd love to hear your voice. So if you're willing to share verbally, Sylvia can unmute you if you use the raise your hand icon, and so we can have a discussion about this. So a couple of responses that I've seen. If patients complete a form with write-in text, do the responses need to be translated? I'd like to learn a little bit about that. Can you help clarify that comment? And if anybody can chime in, please do. That's how we learn. We learn from each other and sharing the information that we have. So please, if you can respond a little bit more about that comment, Lisa, that'd be great. We would like to see our forms simplified. Yes, and so definitely, health literacy is so important in our work. So taking a look at our forms and asking ourselves, how can we be more clear with this information so that everybody understands it? So if a patient writes in Arabic, do the responses need to be translated into English for non-Arabic speaking providers to understand? Great question. So who in the audience is dealing with this in your health centers, and how do you go about doing that? I'd like to hear your responses first, see what you're doing, and I think on this just a bit, and I have some ideas. And this is important because as y'all know, our every day our populations get more diverse, and we're seeing more and more cultures and other languages spoken in our areas. So we want to be able to address those needs, right? For this one, if a patient is writing in Arabic, I would, correct me if I'm wrong, would probably have an interpreter, someone who speaks Arabic, a language line, to be able to help language line, or if they're writing it, you need an interpreter there to be able to interpret what they wrote. But I'd like to find out from you guys if anyone's experienced this and how you handle that. And we'll continue moving, but we'll keep an eye on the chat and see you know, what you guys are doing along for that particular question. Okay, so theme 3, the third theme, is all about engagement, continuous improvement, and accountability. It emphasizes the importance of establishing both individual and organizational responsibility for implementing CLAS. It's about the effective delivery of CLAS, and it demands action across the organization. You know, some considerations or things to think about are, you know, identifying champions and or create a cultural competence committee, conduct organizational assessments on an ongoing basis. And, you know, some people do this like annually. Integrate CLAS into your strategic planning. You want to set benchmarks. You want to ensure that there's sufficient fiscal and human resources to support CLAS implementation. And you want to consider, again, involving community and patients to help you know, monitor the organization's process. So include them as part of your committee, cultural competence committee, if you create one. Those are all things to think about. Now, this theme has 7 standards. It's standards 9 through 15. Again, this is kind of like at a glance of the standards in that theme, and you have that as part of your information. It's a lot of information, we understand that, so we tried and simplify it for you. Again, it's the standard, and then your middle column is kind of like some keywords, some, you know, key concepts regarding that standard, and then a few examples of some strategies or how you might go about taking care of that standard. Let's begin with standard 9. So standard 9 is establish culturally and linguistically appropriate goals, policies, and management accountability, and infuse them throughout the organization's planning and operations. So the purpose of it is to make CLAS central to the organization's service, administrative, and supportive functions. You know, it's to integrate CLAS throughout the whole organization, including your mission statement, and you want to highlight its importance through specific goals. So this is where your goal planning, your action planning comes into place, and you want to link CLAS to other organizational activities, those policies, those procedures, the decision making that's related to outcomes accountability. So part of one of the tools that also was created as a result of the Learning Collaborative was the action planning. And this tool has, you know, you kind of list, it'll list on the left-hand side, it has the standard, and it has whether the standard's being met or not being met, and then it has columns for you to insert your strategies to implement some ideas. Now, we're going to talk a little bit about this some more later. First, before you would do action planning, you would need to do that self-assessment, right? You want to know where you're at, where your organization, your health center is at in providing CLAS to your patients. So we will come back to this action planning, but I just wanted you to see there's a tool, and that is part of, you know, the planning goes into standard 9. So Standard 9, some implementation strategies would include to allocate resources to support class efforts, make sure you have a strategic plan to identify what measurable goals, objectives, and timelines. You want to, again, encourage governance and leadership to establish education and training requirements, and you want to establish how are you going to, see if you're accountable, how, making sure it's working. Standard 10 is about, again, conducting these ongoing assessments. I mentioned earlier, a lot of these standards kind of overlap with each other. So just a heads up there. But you want to make sure that you're doing ongoing assessments of these activities, and you want to integrate class-related measures into the measurement and continuous quality improvement activities. So you want to obtain information about the organization, who it's serving. That can be used to tailor and improve services. And a lot of you have that information. You're capturing this information already. So you need to use that information to help you plan goals and around class. Strategies, you want to take a look at your assets, right? You want to know bilingual staff members who could be used as interpreters. You want to take a look at existing relationships with community-based ethnic organizations that you could maybe use. You want to take a look at your mission statement, recruit individuals or people from diverse cultures into, management positions, many different things to look at. Conducting focus groups is very useful with individuals to monitor their progress and identify barriers to fulfill class implementation. Standard 11 is collect and maintain that accurate, reliable demographic data to monitor and evaluate the impact of class on health equity and outcomes, and to inform service delivery. Again, you're probably capturing some of this data so you have it available, and when you do your self-assessment, that's information you'll need. You want to make sure having this information helps to be able to plan your services. Maybe they need a change. I've heard health centers create services and then their populations changed, and so it doesn't fit anymore. So you want to do this on a regular basis and monitor the needs, assess, utilize, and quality of care in the outcome patterns of all of those things. You want to ensure equal allocation of organizational resources. You want to integrate race and ethnicity language data into the EMRs. And you want to set a schedule to update this data periodically. How often are you going to do this? You can do this once a year, every 6 months. Those are some things to take in consideration. Some strategies to look at. Again, use multiple opportunities to collect data, maybe at enrollment, risk assessments, consumer complaints. You want to train staff on the purpose of collecting this data, right? If they understand why it's important, why you need to get it, then they're more likely to obtain that information. And you want to explain to clients or their patients why you need the data, how it's going to be used, and you want to train your employees how to verbalize this to your patients, right? Okay, standard 12 is about, again, assessing. This one's to determine the service assets and needs of the populations that you're serving. It's about identifying all of the services that are available and not available to your populations, so that you can resource inventory and fill in gaps where needed. You want to determine what services to provide, how to provide them, and all of that would be based on the results of your community assessment. You want to ensure that health and healthcare organizations obtain this information demographically, culturally, linguistically. That way you can use that data to better understand who you're serving. So basically, conduct needs assessments, identifying clients suffering with health disparities. And you want to make sure that all current data profiles are available to staff and to the community. So some strategies to consider are, partner with other organizations and to negotiate data sharing, which could facilitate the linking of different types of data. You want to collaborate with other organizations and stakeholders in the data collection, the analysis, in the reporting efforts, so that you can increase data reliability and validity. And you want to review this demographic data collected with these other organizations as well. So standard 13, that's again partnering with the community to design, implement, and evaluate policies, practices, and services so that you can ensure cultural and linguistic appropriateness. So you want to provide responsive, appropriate service delivery to your community. And you want to make sure that services are informed and guided by the community interests and the expertise of the community and the needs to help increase use of your services by engaging individuals and groups in the community to help you design and improve the services so that you're meeting the needs of and desires of your community, right? You want to create a culture that leads to more responsive, more efficient, and effective services and accountability to your community. And this helps empower members of the community in becoming active participants in the healthcare process. Some strategies here are, you want to partner again with local media, promote better understanding of what you provide, of the available care and services, and the right way to, the appropriate routes to accessing services among the community members. You want to sponsor or participate in health fairs, cultural festivals, and celebrations. And I know I've heard a lot of health centers do that. They do that well. You want to offer education and training opportunities. Some health centers are doing town hall meetings, or they're holding community forums or focus groups. The point is to collaborate more with your community, with the different organizations, partners, to help you accomplish these things. I know a lot of health centers are great at using the community health workers, promotores, as like the links or the in-between between the health and social services within the community. Great way to do that. So standard 14 is to create conflict and grievance resolution processes that are culturally and linguistically appropriate to identify, prevent, and resolve conflicts or complaints. So this helps to facilitate open and transparent two-way communication and feedback mechanisms between the individuals and the organizations. You want to be able to anticipate, identify, and respond to cross-cultural needs. So meet federal, and it helps you to meet federal or state level regulations that address topics such as grievance procedures, discrimination policies. All of those things are included. Strategies for those are training staff as mediators in cross-cultural conflict resolution. It's a great idea there. Promote diversity through your policies. Respond to complaints through a culturally appropriate process. Again, making this including a policy grievance resolution in your patient bill of rights. So standard 15 is to communicate the organization's progress in implementing and sustaining CLAS to all stakeholders, constituents, and the general public. How are you doing this? Are you providing this information, through, one, are you sharing that information about your organization's cultural competence with the public? Do you provide public notice to communicate, that this information is available? So you want to be thinking about things such as the ways you're doing this. Are you posting the assessments so that patients or clients can see, such as newsletters, websites, media. Consider what resources are going to help you achieve this standard. And do you share this with the community and your partners? So some strategies for that are sharing these results from the performance measures, satisfaction ratings, QI, and clinical outcome data, and cost effectiveness. Sharing culturally and linguistically appropriate materials. I mentioned like focus groups. You might want to think of educational forums, partnering with other organizations to lead discussions about these services that are provided and how progress is made. So, taking a look at these, around theme 3, which has to do with engagement, continuous improvement, and accountability, please share with us something that you're already doing that addresses these standards, or maybe something that you think your organization would benefit from. Let's use your chat box to share some of those, and I'll open that up so we can take a look. And things to consider is, how will these standards help you to achieve health equity? So we'll just take a few minutes or a minute or less. Would love to have some discussion on this and a little more interaction. So someone's sharing the use of promotores or community outreach workers from the community served. It's very instrumental in getting the word out of the services that are available, and letting patients, community members know transportation is available if that's in your area, or helping them navigate the healthcare system, which can be very complicated. Anything from the standards out of theme 3 that maybe you haven't seen in your health center that you think is a great idea that to implement? Something you'd like to see being done? We'd like to see more work with refugee populations to explain levels of care, what needs to be an emergency room visit, walk-in at the clinic, appointment. Yes, those are great ideas. And yeah, so think about how can what organizations work with refugee populations, right? And how can you build a relationship with those and partner with those organizations so that you can explain the services that you have and help them to be able to navigate your health system. Okay, well, if you'll, Sylvia, if you'll keep an eye on the chat box for me, I'm going to go ahead and I think we have a poll question coming up. So let's get to that and we'll come back to this, and because I do want to share those tools with you and talk a little bit about those. So poll question number 3, it's the last, I think the last one. What support would be most helpful to you as you develop and implement a class plan? You know, creating a formal plan, attaining commitment at governance and leadership levels, attaining staff buy-in and engagement, providing staff training regarding culture and language access issues, or maybe something else. If you could please, if it's something else, answer that in the chat feature. Let's see. If you'll take just like 30 seconds to complete this poll, so we can move on to the tools. Okay, I think the poll results are in, right? Okay, so 67% share that providing training regarding culture and language access would be the most helpful. And then next to that, creating a formal plan are the two options that were mentioned here. Great. Okay. So that is helpful in knowing. And as part of, let's see, one of the tools, we'll talk a little bit about the tools that are available to you. The self-assessment, as mentioned previously, you need to know what you're doing already, because without a doubt, we know that class is being addressed somehow. Maybe it's not being documented, you know, or like in a plan. So the self-assessment is a tool that was designed to be easy to use, practical, and short. We know you're really busy, and so this is a way for you to measure, find out what you're doing around class so that you can see where there's room for growth, right? And then once you have this form filled out, and it's one of the downloadable tools, then you would move to your action plan. So you would see the assessment is broken down by themes to kind of help you simplify the areas that you're working on. So theme 1, which is all around governance, leadership, and workforce. A question, for example, would be, does your organization have written policies and procedures that support recruitment, retention, training, and promotion practices that support class? And then there's a section on theme 2 that talks about anything relating to language communication. So, and then theme 3 around the engagement and continuous improvement, accountability. So once that assessment is filled out, you can mark it in your template and see, okay, we're doing this, oh, we're not doing this, so what can we do? What are some areas that we can work on? And then use the strategies that ideas that are there to help you plan your next steps, right? And if you're interested, before I move on to, so this is the CLAS Standards Guide that you have also. It's again broken down by themes, and it has some examples of strategies. But the important thing here too is if you really want to see, work on getting a plan, making sure that you have CLAS, you're implementing and integrating CLAS strategies into your health center, then take a look at the Learning Collaborative, because we will help you to fill out the self-assessment, and then from there we can help you put together, fill out the implementation plan, and then you pick an area to work on. You don't need to take it all in one big chunk. Just knowing what areas there's room for growth, and then tackling, maybe one or two areas that you want to focus on. When those are achieved, then you move on to another one or two that you choose. So to kind of help make it a little bit easier on you. So did you identify one or two standards that you would like to address or make improvements on? I'd like to hear from you which of the standards you feel your health center could benefit from working on. And then is there one thing that you can do now to support the implementation of CLAS? So answer that and use your chat box to answer that question. Maybe it's, who has a CLAS committee in their organization? Now, do you have a few key individuals in the organization that would be like your CLAS champions that can kind of lead the effort in accomplishing and integrating CLAS more into the work that you're doing? Does anybody have a CLAS committee? I'm curious to learn if you can answer that. So we'll just take a few more minutes to fill it out in the chat box. Just would love to get some feedback, see what you guys think, what areas you feel like you could improve on at your health center. Out of the things that we reviewed, what would be something simple that you could incorporate, easily and quickly? I think the training definitely would be a good place to start. I think someone mentioned that earlier. And Sylvia, if you see anything pop up in the chat, please, if you would share that with us. I'm going to collapse my little panel here so I can get back to the PowerPoint. As I mentioned, we have a CLAS Learning Collaborative where we kind of help guide you through the process. It's not time consuming, but it's there to help you and learn from each other, to be able to implement some of these things easier. Like I said, we will help you assess what you're doing at your organization and help you put together the plan, and then go over strategies that might be helpful for you to implement, including training for your leadership, which is critical, and getting that support to be able to move forward with some of these initiatives. Now, so on the class, if you'd like more information on the CLAS Learning Collaborative, go ahead and type that into your chat box so that someone can get back to you with that information. I do want to point out that there's a lot of opportunities for additional training. There's several, the agricultural worker forums, and there's the national conference. The East Coast Migrant Stream Forum is going to come up pretty quick. I mean, before you know it, it's in October, on October 9th through 11th, and that is going to be in Puerto Rico. And then our Midwest Stream Forum, which NCFH hosts, is going to be in Denver, Colorado on September 24th through the 27th. And then the Western Forum for Migrant and Community Health, that is scheduled for February 19th through 21st, and that's going to be in Sacramento, California. And then the National Conference on Agricultural Worker Health is typically in May, so it just happened recently. So there'll be more information with dates coming up if that's one that you're interested in. It supports all community health centers, and great opportunities to continue learning and going back and sharing that information with your colleagues. So we're going to open it up for questions. If anyone has any questions, comments, suggestions, we'd love to hear them. If anybody needs to reach out to us, you have the tools now. So what are you going to do with those tools? And it's a lot of information, we understand, to cover. So if you need help digesting some of the information, what the standards mean, we're here to help you. And that's what we love to do, is to work with you guys. And in particular, with the CLAS standards. So yeah, call us.